Episode of Ask the Doc usually has a theme, but once in a while we like to throw in some curveballs, especially when we get so many viewer questions that are so different from one another. And we did this once before and it was so well received that we're bringing it back today. We like to call these episodes Miscellaneous Medical Maladies Part 2. We have a hodgepodge of viewer questions and we haven't been able to get to them until now. So today, we'll tackle these questions and more on this episode dedicated to our wonderful viewers. Welcome to Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome to Ask the Doc, the show where we encourage you, our viewers, to send in your healthcare questions and we try to answer them. My name is Dr. Kamaljit Kaur, and I am a concierge primary care physician here in beautiful South Florida. Let's get to it. Today's first question comes to us from Crystal, and Crystal reached out to us from our website, allhealthtv.com. And her question is, hello, Dr. Kaur. My 65-year-old husband was recently diagnosed with benign prostatic hyperplasia stage 3. He's also experiencing hematuria. My question is this: what is the best treatment for both conditions? Hi, Crystal. Thank you for sending in your question. And I'm so sorry to hear about the troubles that your husband is having with his prostate. Now, for those of you who may not know, I'm going to talk a little bit about what BPH is. BPH, or benign prostatic hyperplasia, is a condition that may occur as some men age, and this results in formation of nodules on the prostate gland. And that in itself can cause a variety of annoying and intrusive symptoms. BPH can be classified using a person's symptoms or the findings on an MRI. It depends on those two factors as to what stage or what grade you will be classified in. Commonly, though, we use the terms mild, moderate, and severe to classify by symptoms. Now, getting to the stages. Stage 1 is generally when there's not really a lot of obstruction, physical obstruction by the prostate gland, and then there's not a lot of symptoms either. Then you have stage 3, where a man could experience some symptoms, but there's real no obstruction, not anything significant at least. Then you have stage 3, which is what your husband was experiencing or is experiencing. And this is when the enlargement of the prostate gland has caused a significant amount of obstruction, and they may or may not be having symptoms. Believe it or not, there are times when the prostate gland, is so enlarged that it causes a certain degree of obstruction, but the patient may not have significant symptoms. Everyone's different, right? Then there's stage 4, when you begin having complications of the obstruction. So you might have recurrent urinary tract infections. You might even develop stones in the bladder, similar to kidney stones. You may also experience bleeding, which is what your husband is unfortunately experiencing. Now, if your husband is having bleeding, he has probably progressed from stage 3, at least symptomatically. But like I said earlier, it's very important to see what his actual findings on imaging tests like MRI are, and that will determine how these conditions, or how this condition in particular, is treated. Nevertheless, the treatment depends on how bad the symptoms are. And really, sometimes it may even require surgery, especially if it's something that's progressing or causing complications, like I mentioned a little bit earlier. His urologist may actually suggest that we start with medications or medical treatment before going to surgery. Surgery for most conditions is usually the last resort. So you want to see if you can treat your symptoms and treat your disease with more benign or less invasive methods, such as oral medications or IV medications, whatever is appropriate for that condition. Now, it really, really does depend on your personal clinical course as to what you're going to be recommended. So I do recommend going back to your PCP and your urologist and sitting down and letting them know exactly the symptoms that you're having, discussing what your imaging findings have been, and what is going to be the best method to move forward for you. Remember, we always want to do the best treatment that's going to help our patient and is going to benefit them in the long run and is going to expose them to the least amount of risk or potential side effects. So keeping that in mind, I hope you do feel better soon. All right, let's get to the next question. This one comes to us from Elena, and she reached out to us through YouTube. Elena asks, Hi, Dr. Kaur. I'm 76 years young. That's wonderful. For many years now, I've had painful Charlie horses that reach down to my toes, involuntarily curling them. It happens mostly in bed at night. I've had a number of tests done, but none of them have been able to pinpoint the problem. Can you help me, please? Elena, I'm so sorry that you're experiencing this. I myself have experienced Charlie horses while sleeping, and let me tell you, I get it. It can be quite painful. And then, of course, it wakes you up from sleep, and that's just annoying, right? You need to get a good night's sleep, and anything that interrupts that can be bothersome. So, Charlie horses, basically, what that means is a certain muscle is involuntarily cramping up or contracting. Charlie horses specifically refers to the calf muscle. And did you know that actually 40% of the population over the age of 50 will experience or will have experienced Charlie horses? It's actually quite common. And the cause is what we call multifactorial. There's many different causes. There's many different reasons that somebody might experience this. And we're really not well versed in every single one of them. So we don't really have a definitive, this is exactly what causes Charlie horses and this is it. But we have some ideas of what risk factors somebody might have that might predispose them to experiencing these type of involuntary muscle contractions, painful muscle contractions sometimes. Some of these risk factors are repetitive stress on your legs. So if you've been on your feet all day and you've not taken even a minute to rest, and you're not somebody that's used to doing that, that's putting a lot of stress on your legs, the muscles, the joints, the bones. So they may react in a certain way. Then certain medications. Now, that population over 50 in which 40% will experience these muscle cramps, it's no coincidence that that's also the population that's probably on some chronic medications like blood pressure medications. There's even benzodiazepines like Xanax, Valium, diazepam, birth control pills. There are some birth control pills that can contribute to this as well. And then some chemotherapy medications. Now, that's not an exhaustive list, but that's kind of the most common ones that we see muscle cramps associated with. In addition to those risk factors, there's other systemic diseases that can contribute to Charlie horses or involuntary muscle contractions, peripheral vascular disease. So this is basically when these certain parts of your body, like your feet, your legs, your hands, your fingertips, aren't getting the blood flow that they need to work optimally. And because of that, those areas are being deficient in a lot of nutrients. They're not getting what they need, right? So they're going to react in a negative way. And sometimes it shows up as a painful muscle cramp. Dehydration. I think this is one that a lot of us know about. Being dehydrated, not having the electrolyte stores that you need to have, because for your muscles to contract, it's important to have a lot of different kind of electrolytes, calcium, magnesium, potassium. So when you don't get enough of those or don't have enough of those in your system, then it's going to be something that's going to impact the way the muscle works, and it's probably going to make it do that involuntary contraction. Pregnancy. Did you know that pregnancy can increase your risk as well? And there's a lot of reasons why that happens, but pregnancy can increase your risk of having Charlie horses or muscle contractions, involuntary muscle contractions. Some disorders like thyroid disorders, thyroid imbalance, diabetes, alcoholism. I mean, the list goes on. Point is that there's a lot of reasons why somebody can get and experience Charlie horses. Sometimes, though, Charlie horses can also be a sign of a sleep disorder. So that's something that you really want to get looked into, especially if you're experiencing them mostly at night. Finding out what the exact cause of your Charlie horses are and what is contributing to the formation of them is going to be important in how you treat them, because we always want to treat the root cause of something, right? There are times when you can put a Band-Aid on a problem and temporarily do something to provide relief. But if this is a reoccurring problem, don't you want to get to the root of it and really get down to what's causing it? Because treating that is going to be ultimately the best thing to do for your long-term health. But there are certain things that you can do the moment you're experiencing a Charlie horse. So the number one thing is stretching. I know you're probably already awoken from sleep. You're probably already a little bit annoyed, but you want to get up, you want to stretch that muscle out, maybe even walk around a little bit, because restoring blood flow to that muscle and getting it moving like it should be will probably be the best thing to do to get it to go away in that moment. You can also try elevating your legs while you're in bed. And then you can also try an ice massage. That can help too sometimes. If you're experiencing these frequently, Elena, really, I encourage you to talk to your PCP about it because there may be another problem that this is a sign of, and that's what you should really be getting treatment for, right? I hope you feel better soon. All right, we've got another question, and this one comes out to us from YouTube, and this is from Graziak. I apologize if I mispronounced that, but that is a beautiful name. All right, Graziak asks, hey doc, I've got a strange pain inside my head. It's like the pressure you get on a plane. I got an MRI scan and it didn't show anything. It's in different parts of my head, sometimes on top or the back of my head. Can it be TMJ? And is it something that vitamins and herbs might be able to help? Thank you so much for reaching out, Graziak. This is a great question, and I'm sorry that you're feeling this. I have so many more questions to ask you. If I were your PCP, I'd really want to get into the nitty-gritty details. How often are you experiencing this? When do you experience it? Do you notice any triggers to it? How long does it last? What exactly does it feel like? Do you have any other symptoms when you're experiencing this? And what does it take to go away, or does it go away on its own? And all of those questions are very important in determining a list of suspected diseases that might be causing your symptom, and then getting to tackle those and treating those. Depending on those answers, I'd compile that list and then we would investigate further depending on what's needed. So do we need to do blood work to figure it out? Do we need to do more scans to figure it out? Believe it or not all brain and head related conditions show up on a CAT scan or on an MRI. The most dangerous ones generally do. So I'm very reassured to hear that your MRI was unremarkable, because that's reassuring that we're not dealing with anything too significant. But either way, like I said, not everything shows up on an MRI. So you really want to get down to the nitty gritty of it. Now, about the TMJ. TMJ is a condition that, yes, it can cause pain and it can cause pressure in the head, but just not the way that you're describing it. If it is TMJ, you're going to need very specific treatment for that. And generally that may involve your dentist as well. So you may want to reach out not only to your primary care physician, but to your dentist too, to see if that's something that's contributing. Because TMJ can be quite painful, it can be progressive, and unless that's treated, they're going to continue to get those headaches. The other thing about TMJ and its treatment is it's unlikely to be benefited by vitamins and minerals and herbs. It's something that needs a little bit more of a drastic type of treatment. Sometimes even a mouth guard or a mouth appliance helps. But again, that's something that your dentist will tell you a little bit more about. I do encourage you to readdress this pain with your doctor and, like I said, with your dentist, so you can get more personalized recommendations and hopefully you can feel better soon. All right, folks, in case you missed it the first time around, here's how you can send in your questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Our next question comes to us from Michael, and he reached out through YouTube. Michael asks, hi, doctor. I have an itching and scratching issue, and I don't know what to do. My stomach and neck are the problem areas, so I went to the emergency room, and all they did was give me antibiotics and painkillers. Unfortunately, I'm still itching in the same exact areas. So I'm wondering if it could be a kidney or hernia issue. Hi, Michael. Thank you for sending in your question. And I'm sorry you're feeling this way. It can be quite annoying, I'm sure. Now, itching of the skin can occur for a variety of reasons. Most of them will differ, and most of them will differ in the way we treat them. Because remember, we're always trying to treat the root cause of a symptom. So for instance, if you're itching because you have a fungal infection, then you're probably going to be given antifungal medications to treat it. You may also be given some soothing medications like topical steroids to put on the areas around it, but generally it's going to be that antifungal that's going to be your targeted treatment for the itching caused by that. Now, itching can also come from conditions like eczema and psoriasis, and the medications for those are very different from antifungals. Those medications are the topical steroids that I mentioned just a minute ago. But sometimes, did you know that even though eczema and psoriasis are not infectious conditions, they're not caused by bacteria and they're not caused by fungus, they can develop bacterial or fungal infections on top of them? I mean, I feel so bad if that's what's going on, because that's just something so much harder to tackle, but we can treat it. And the treatment for that is generally a combination of medications. Now, if this happens, then of course, you treat the eczema, and then you want to treat the bacterial infection or the fungal infection as well, because you don't want it to spread and cause more itching or more infection, of course. Now, you were likely given an antibiotic by the ER physician because you have a bacterial infection. I'm not sure if you were given a topical one or an oral one, but either way, that's probably why that was prescribed. I'm not sure, to be honest with you, why you were prescribed a painkiller, but I assume it's because the ER physician saw something else or felt that you had another issue going on that would benefit from that medication. Nevertheless, skin conditions are generally not related to the kidneys or representative of a hernia, but that might be a sign of something else going on that may be an indirect relation to those items. The body's all connected, so we can never say, nope, this is definitely not related to this, unless we do a thorough investigation to figure out why. There are many missing pieces to the puzzle of your question, so unfortunately, I'm not able to give you a more direct or more linear answer, but I really encourage you to talk to your primary care physician. Anytime anybody goes to an emergency room, you should always follow up with your primary care physician so you know what happened in the ER, why you were given the meds you were given, and what to do moving forward so you can treat what you experience and prevent it from happening again. I hope you feel better soon. All right, friends, we have another question from YouTube, and this one comes to us from April, and April asks, Dr. Kaur, warning, my question is a little graphic. I just noticed a thick and creamy vaginal discharge, and I'm wondering if it's a result of all the hormonal gels that I've been using. We're talking testosterone, estrogen, as well as progesterone. Could all these hormone creams be the cause of my discharge? Hi, April. Thank you so much for sending in your very personal question. I'm very proud of you to reach out to us and to seek help and to really want to know what's going on with your body. So kudos to you for that. Now, as far as vaginal discharge goes, there can be a lot of reasons for it. Yes, it could be a yeast infection, it could be another kind of infection, or believe it or not, it could be completely benign and normal as well. And yes, hormone replacement therapy, as necessary as it is sometimes and as beneficial as it is sometimes, can increase your risk, unfortunately, of yeast infections. It can also increase the production of vaginal discharge as a benign side effect of it. Now, a lot of hormone replacement therapy increases the amount of estrogen that's in your body. When you have more estrogen running around in the body, that actually stimulates some of the glands in the vaginal and genital areas to produce more discharge or more fluid. And that might be what you're seeing as the thick and creamy discharge. Sometimes, though, that discharge is thin and watery. So it can go either way. Now, I'm glad you're not feeling irritation or itching or pain, but either way, you should really talk to your gynecologist or your primary care physician to see what is going on, where's this discharge coming from, what is causing it, and really how to treat it. Now, if it's the hormone replacement therapy that's causing it, then you always want to do a benefit and risk weighing, right? Is the benefit of your hormone replacement greater than the potential of the side effects and the risk that it's causing to you? So you want to have those detailed discussions with your doctor anytime a man or a woman is prescribed hormone replacement therapy. I hope you get your answers and you feel better soon. All right, we have another itch-related question coming to us today, and it comes through our Facebook page from Maddie. Thank you for sending in a question, Maddie. He asks, Doctor, my whole body is itching a lot. I'm wondering if it's from the long COVID I have. Long COVID is worrisome enough, but to add a full body rash for the past 4 weeks makes it really scary. I've been using antiseptic and cocoa butter, which seems to be helping, but is there something better I can do? Oh, I'm so sorry you're going through this, Maddie. Honestly, and to be transparent, I experienced long COVID and I understand how frustrating it can be. So, long COVID, post COVID syndrome, chronic COVID-19, whatever the term is that your physician or your medical team is using, all in all, it means that you or the individual who's experiencing it has developed persistent or new symptoms after the initial COVID-19 infection. And yes, folks, it's still out there. I know it's not talked about a lot on the news or on the media, but COVID-19 is still out there and long COVID is still out there, unfortunately, as well. Now, long COVID can have a variety of symptoms. You can experience fatigue, And this could be something that you've experienced long term. You can have shortness of breath, inability sleeping or disturbed sleep, that loss of smell and the loss of taste, that can happen as well. Loss of smell is the more common one, though. And then muscle aches and pains as well. Now, those are the more common ones, but there are other symptoms that somebody can experience as part of long COVID, such as dizziness, loss of appetite, hair loss. I know many of us have experienced that, joint pains, recurrent headaches. And honestly, that list can go on. But either way, these are all part of a potential long COVID syndrome. Now, in addition to the physical symptoms, you can also experience psychological symptoms. So, onset of depression, anxiety, even PTSD, actually. A lot of people don't know that. So I think that's important to note. Now, generalized body itching, like you're experiencing, is not a commonly seen symptom with long COVID or with COVID at all. Now, whole body itching can actually be a sign of a more systemic problem. When we when we incur this in practice, we usually think the liver first because we think of bilirubin, the liver enzymes, and excess of some of those items can cause itching in the entire body. So anytime somebody comes to us and says, "Hey doc, my whole body is itching," that's one of the first things we think about. But then we also think about allergic reactions that can cause whole body itching as well. Either way, a lot more items are needed to be determined in order to figure out if your whole body itching is part of long COVID or part of a whole different systemic disease altogether. Either way, please talk to your primary care physician for more personalized recommendations. All right, guys, if you've got questions, we've got answers. And just in case you missed it the first time, here's how you can send us those questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
All right, let's get to our next question. And this comes to us from our website, allhealthtv.com. And this one comes from Bernard. Bernard asks, "Greetings, Dr. Kaur. I'm an 82-year-old man who stopped driving 2.5 years ago because I have peripheral neuropathy. I write left-handed, but after writing for a few minutes, my thumb goes numb and gets painful. Can you suggest anything to help reduce the pain and numbness?" Hi, Bernard. Thank you for sending in your question. And I'm sorry you're experiencing this. That sounds very, very intrusive and annoying and painful. Now, peripheral neuropathy can cause very intrusive symptoms and can actually be really difficult to treat as well. Cramping of the fingers is one of the most common symptoms that we see with peripheral neuropathy in the hands. And unfortunately, it can be difficult to manage. The treatment of it really depends on what is the cause of your peripheral neuropathy. For instance, is it diabetes? Is it a vitamin deficiency? Is it a local inflammation or irritation of the muscles and nerves of your fingers? The treatment of it is really going to depend on what is causing it and those factors. And once you can target those, then hopefully your symptoms can alleviate and you can get rid of that tingling feeling and the pain and the cramping. So really discuss with your PCP what is the cause of your peripheral neuropathy and what is the best way to move forward in treating it. And can it be fully resolved or not? Because you want to set expectations and know what you can do to prevent exacerbations in the future. One of the best things you can do for peripheral neuropathy and cramping of any cause is stretching. So you want to make sure that you're stretching on a regular basis and you're keeping those muscles loose and flexible and those joints flexible and the tendons flexible as well. You want to make sure everything's working perfectly, right? I hope you can get some answers and I hope you get to feel better soon. All right, folks, we have time for one more question, and this comes to us from All Health TV, and this is sent in by Eloise. Eloise asks, "Dr. K, what are the health risks associated with high alcohol consumption in men, and how can they seek help for alcohol dependence? I'm obviously asking for a friend." Hello, Eloise. Thank you so much for sending in your question, and I'm so proud of you for sending this in for your friend. Alcohol is one of those substances that we can enjoy sporadically, but can easily become something that is addictive as well, and it can cause a lot of healthcare related problems. It can cause one of the most common things that we know is cancer. It can also cause cardiovascular disease, diabetes, a whole bunch of things, autoimmune conditions, pancreatitis. sexual problems as well. So a lot of different things that it can cause. So it's really important to seek ways to help reduce your alcohol intake. And you want to do that gradually, not drastically, because that can be dangerous as well. Now, I encourage you to discuss with your primary care physician what are the best resources for you. Of course, there's always Alcoholics Anonymous as well, AA, and there's other local resources too, but try starting with your primary care physician so you can develop a plan to move forward safely and successfully when it comes to cutting down on alcohol and cutting it out completely, because it is one of those substances that we want to try to avoid. I hope this works for you, and I wish you well. All right, folks. Well, that was our episode for today. And I had a great time addressing this mishmash of questions from A to Z. It's been a very educational attempt. I hope you guys have learned something, and I hope you've enjoyed it. Please keep sending us those questions, and I would love to help you answer them. I look forward to seeing you again next week here on Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.